Now, once the diagnosis of fibromyalgia has been established, the real adventure begins. How do we treat it? Well, although there is currently no cure for fibromyalgia, symptoms can be substantially controlled by a comprehensive treatment that includes education, medication, and physical conditioning to improve aerobic capacity and flexibility, as well as psychological intervention aimed at stress management. Because the probable causes of the symptoms of fibromyalgia are so contextual, they are best treated by a combination of interventions. The most effective treatment protocols include a holistic approach to managing and reducing the symptoms. The important issues to get guidance for from your doctor about include three primary areas: improving sleep, managing stress or depression, and improving muscle function. Now, there is no agreed upon standard of care or proven treatment for fibromyalgia. Rather, what we have to work with is a collection of various approaches that address different symptoms, each approach having varying levels of success with each fibromyalgia patient. A complete look at the full range of conventional, alternative, mind-body, nutritional, vitamin, and herbal treatments are presented throughout the remainder of these videos, along with guidelines on how best to develop an integrated plan for your own recovery and wellness. However, since lifestyle changes may help you find fibromyalgia pain relief, here are some productive alternatives for you to consider now. Studies show that the actions most likely to help with the pain of fibromyalgia are light aerobic exercise, such as walking or water exercise, and even some light strength training. Of course, you're going to want to check with your doctor before you start any exercise program, but if this is a reasonable option for you, there are a few things to remember. Number one, start slow. If you're moving more today than yesterday, that's progress. Listen closely to your body. It's important that you don't overdo it. Don't increase your activity too quickly. Start with just a few minutes of gentle exercise every day, but do it every day. And then work your way up. Track your progress. Note the exercises that you're doing and how you feel during and afterward. Stretch your muscles before and after every exercise. The post-exercise soreness will decrease over time, but respond to your body's signals and pace yourself. Now, also, it's important to stick to a sleep schedule. If you go to bed at the same time every night, your body is going to get used to falling asleep at that time. So choose a time and stay with it, even on the weekends. Also, if you keep the room cool, you're going to sleep much more comfortably and much more deeply than if the room is too warm. According to the National Sleep Foundation, studies show that you're likely to sleep better in a room that's on the cool side. So try turning down the thermostat and or keeping a fan on hand as evening approaches. Now, toward bedtime, you're going to want to cut out a few things, like caffeine, for instance, because caffeine has a wake-up effect that lasts. It is best to avoid it well before bedtime. Now, this includes not just coffee, but also tea and colas and chocolate. You want to avoid alcohol before bed because that nightcap, even though it makes you sleepy at first, will cause your blood alcohol levels to drop, and it's going to have the opposite effect. You may find yourself wide awake in the middle of the night. Now, when you exercise in the afternoon, because exercise in the afternoon may help you sleep more deeply at night, but exercising before bedtime can make it harder to fall asleep. Now, nap if you need to, but keep it brief. If you're so tired that you just have to take a nap, set the alarm for 20 minutes. You snooze any longer and you're going to have trouble falling asleep at night. Now, make your bedroom a relaxing refuge. Treat yourself to comfortable bedclothes, snuggly pajamas. A white noise machine or fan may help you fall asleep to soothing background sounds. Develop a relaxing bedtime routine. Reading helps some people fall asleep. So does listening to soft music. But do whatever works for you. But try to follow the same routine every night to signal your body that it's time for you to sleep. You can safely experiment with any or all of these on your own to see what's effective and what works, what aggravates your condition. and what seems to provide benefit and relief for you. In the final analysis, you are the only one who can make these decisions, because even though this condition is not your fault, deciding how to deal with and manage it is your responsibility. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my Fibromyalgia Roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.